The ACL is a large structural ligament that connects the upper leg to the lower leg. Specifically, it connects the femur bone to the tibia, and it's important for stabilization of the knee in different directions. Specifically, it provides stability during cutting sports such as soccer. An injury to the ACL can occur in two ways. One is with a contact injury and one is with non-contact injury. Contact injury, for instance, a slide tackle, if someone hits the knee and it's twisted in a certain direction, this can tear the ACL. Non-contact injuries occur on occasion when an athlete plants and turns to pivot and the knee shifts, shearing the ACL away from the two bones. Unfortunately, a torn ACL won't necessarily just heal on its own, even with time or just with bracing. Typically, they need surgical reconstruction. The athlete will go through the post-operative period of recovery, a period of physical therapy, and then often return to the field with a brace. An important part of sports medicine is trying to prevent injuries in the first place. One of the ways we believe we can improve ACL protection and prevent injuries is working on lower body strengthening and balance retraining. Hip strengthening can help prevent an action where the knee collapses in when an athlete twists or turns or changes direction rapidly. At the Micheli Center, we work on hip abductor strengthening, balance retraining, and landing techniques that reduce the shear force or twisting force on the ACL, and this seems to improve injury rates. Current research about ACLs include injury rates between men and women athletes. In addition, there's lots of research about how best to reconstruct or heal an ACL tear. This includes surgical techniques and bracing techniques. At the Micheli Center, we're working hard to develop and implement programs that have several approaches. One is the safe return of athletes back to sport after surgery. The second is injury prevention itself. The injury prevention programs at the Micheli Center center around improving certain mechanics above and below the knee. These include quadricep activation, hamstring strength, hip strength, and landing techniques to prevent shear force around the knee.